Expert Insights, Understanding Nipah Virus Infection with Dr. Jitendra Choudhary. Hello and welcome to Medical Dialogues Journal Club. I'm Isra Zaman and today I'm here to discuss the recent outbreak of Nipah virus, a zoonotic virus that causes infection in humans and other animals, a disease with a high mortality rate. In its recent outbreak in Kerala, the tally stands at 6 cases including 2 fatalities. To gain insights into this potentially life-threatening disease, we have with us today Dr. Jitendra Choudhary, who is a consultant at Intensive Care and Critical Care, Hiranandani Hospital, Vashi. We welcome you to Medical Dialogue, sir.
Hello.
So, sir, can you tell us why we should be concerned about the Nipah virus infection?
So, as you rightly said, it is a extremely endemic virus, zoonotic, with a very high mortality rate. It has been first diagnosed in 1998 in Malaysia, and India is in the Nipah zone or belt, where we are seeing a repeated outbreaks in between. So the commonest outbreaks initially were seen in Siliguri in 2002-2004, and since 2018 we have been seeing a common outbreaks in Kerala area, where the mortality rate is as high as 70 to 80%. Now also out of the 23, only 2 are the survivors, right? So this is an extremely dangerous virus where a risk of transmission is also very high, and that is the reason we need to be very cautious about Nipah virus, especially when we are coming out of one pandemic.
Alright, sir. So how is the virus transmitted and what are the common symptoms that patients should be aware of?
So the commonest, it is a zoonotic virus. That means it is commonly present in animals. The commonest animal which is responsible for this virus is a bats, and the transmission will happen either from the direct contact with a bat, or there are few animal reservoirs such as pigs. So a bat which comes into contact with a pig, and sick pig coming in contact with a human, will transmit the virus to human. Along with that, apart from the direct contact, contact with any surface or any food material or any tissue which was contaminated by a saliva of a bat or a contact with a sick animal will transmit the virus. Apart from that, there is a chance of human to human transmission if you get in contact with a infected person's body fluids like saliva, urine, blood. These are the commonest sources or modes of transmission for a Nipah virus transmission. The commonest symptoms are, the initial presenting symptoms may not be very serious. It starts with simple constitutional symptoms like fever, body ache, malaise, and it progresses to neurological symptoms such as patient can have a coma, a patient can have a one-sided weakness, patient can have a seizures activity. So these are the few commonest signs and symptoms. Generally, the period of incubation, the signs and symptoms will generally manifest between 7 to 10 days or 7 to 14 days after a contact with the infected person or infected animal.
Okay, and are there any risk factors for contracting the Nipah virus?
The risk factor is contact with the infected person or infected animal. Apart from that, the chances of mortality and increased risk is in elderly population or very young population, and persons who are already having other comorbidities like diabetes or any other illnesses. They are at increased risk of catching these infections.
Fine, sir. So how is the Nipah virus diagnosed and what is the recommended treatment protocol for individuals who have contracted the disease?
So the diagnosis is, initially there need to be very high suspicion that this is a infection which is not a natural infection, especially infection which have a neurological involvement. There we suspect the patient may be having Nipah virus, and the test to diagnose is you send a PCR test from the body fluids. It could be a throat swab, it could be a CSF sample, and that will diagnose a infection with the Nipah virus. Coming to treatment part, unfortunately, this is a viral infection where there is no particular treatment per se, or there is no effective antiviral per se. So treatment, there have been many therapies which have been tried, like ribavirin and all, but none of these therapies have been effective for the viral infection. So treatment in these patients is supportive therapy.
That was very informative. So, are there any preventive measures or precautions people can take to reduce their risk of contracting the Nipah virus, especially in the endemic areas?
So, the precautions we need to take is avoid the contact with the sick animal, avoid contact with the or avoid consuming raw meat, especially raw pig meat, and while taking care of a sick animal, the person need to be taking care of all the precautions, like wearing gloves, avoiding contact with his salivas and body fluids. Also, the most another commonest source of transmission has been the toddy, raw toddy, which is many times contaminated with the bad saliva. So avoid consuming raw toddy. That is another way you can prevent or avoid catching the infections. The same thing is applicable for taking care of a sick human person also, human patient also. Whenever you are taking precaution, you need to take a universal precautions, universal contact precautions. You need to wear gloves, you need to maintain the barrier and avoid contacts with the sick patient's bodily fluids.
Thank you, doctor, for this enlightening and potentially life-saving discussion. We are confident that the information you have shared will make a positive impact on our viewers, helping them understand the Nipah virus better. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.